Now, this is a huge topic, and I'm not going to even try and cover everything in detail. But I thought I would at least give you a whistle-stop tour through the main imaging modalities, and then stop at a couple of interesting positions where we're at the moment, and just give you a little bit of feel for where we're going in the future. So this is kind of the overview. We'll talk a little bit about coronary disease, invasive imaging, non-invasive, talk about NICE and then emerging. I'm not going to talk too much about the coronary disease because we've already covered most of this. Cliff has nicely already explained to you this diagram. But essentially, our understanding of atherosclerosis has always been that we have development of risk factors which cause injury to our endothelium. We then develop plaques. And in time, these become occlusive and eventually rupture. This is kind of end of last century. And then since then, lots of pathological studies. And following up from what was said previously, that actually the first presentation for many people may just be their heart attack or death and not necessarily angina. And that's because you might actually rupture your plaque quite earlier on. And in fact, autopsy studies have shown that ruptured plaques need not be 70-80% blocking the lumen of a vessel. They can actually only be about 50%.